Is there a vaccine for pulmonary tuberculosis? Have you ever wondered if there is a vaccine for pulmonary tuberculosis? The answer is yes. There is a vaccine called the Bacillus Calmette-Guérin vaccine, commonly known as the BCG vaccine. This is the only vaccine currently available to protect against tuberculosis, including the pulmonary form, which primarily affects the lungs. The BCG vaccine is mainly given to infants and young children, particularly in countries where tuberculosis is common or in populations that are at higher risk for infection. It is effective in protecting against severe forms of tuberculosis in children, such as tuberculosis meningitis and disseminated tuberculosis. However, its effectiveness in preventing pulmonary tuberculosis in adults is limited and varies. Typically, the BCG vaccine is administered shortly after birth or within the first few weeks of life. In many countries, this vaccination is part of the routine immunization schedule for newborns, especially in areas with higher rates of tuberculosis or where there is a greater risk of exposure. For instance, in the United Kingdom, infants in regions with tuberculosis incidence rates of 40 per 100,000 or higher, or those with family origins from high-incidence countries, are offered the BCG vaccine around 28 days old. While the BCG vaccine provides some level of protection, it does not fully prevent pulmonary tuberculosis in adults. It is important to note that vaccination does not replace the need for other tuberculosis control measures. Early diagnosis, treatment of active cases, and public health interventions remain as crucial in managing tuberculosis effectively. Research is ongoing to develop new and more effective vaccines that can provide better protection against all forms of tuberculosis. This is an important area of study as the global fight against tuberculosis continues. In summary, the BCG vaccine is the only approved vaccine for tuberculosis, including pulmonary tuberculosis. It is primarily given to infants and young children in high-risk areas. While it offers good protection against severe childhood tuberculosis, its effectiveness against adult pulmonary tuberculosis is variable. Vaccination policies depend on local tuberculosis incidence and risk factors. For anyone seeking vaccination or advice about tuberculosis prevention, it is essential to consult healthcare professionals to understand the best options based on individual risk and local guidelines.